Well, welcome to Age Friendly, the program here on Rogers that talks and deals with issues and activities and anything related to older adults or seniors here in our community. And if you would like to learn about some specific topic, please go on the agefriendly.ca or agefriendlythunderbay.ca website and send us a message, and we'd be certainly welcome those ideas, and we will look into them for you. My name is Rebecca Johnson. I'm the host of the program, and our program today is on the subject of oral health. Now, oral health, we are going to find out exactly what that is. And of course, my guest today is Lynda McKeown, who is a registered dental hygienist here in our community. And Lynda, I think the first thing I like to do is when we talk about oral health, like I have an idea of what it is because I did a little bit of research before our program and chatting with you as well. But what is oral health? Let's start from there.
Well, oral health, just the short version of it, is a clean, functional, comfortable, pain-free mouth. And taking us to the mouth, that's where your health starts. Mm-hmm. It's really important. This is a connection, your inner and your outer environment with the mouth. I mean, here you and I are speaking, lips are moving, and we're making words, and we're exchanging air. Right. And this has all got to do with the mouth. And when you really think about the mouth, and then the tongue, you know, outer and inner, and the mucosa in the mouth, also all the way through the digestive tract right to the exit. So it's that major connection between the outer environment and the inner environment, and the lips, the cheeks, and the saliva, very important. And so many of these things can tell us how we are. Right. And so it's a mirror. The mouth is a mirror on what our health condition is. You notice I didn't even mention the teeth.
No, it's the mouth. It's the mouth.
No, but the teeth, of course, are very important. I mean, we wouldn't be making these words as well as we would without them. Right. And they're very complicated, too, with their own nerve supply and pulse supply that keeps them alive.
Although we're talking about older adults today, yes, we also have to acknowledge the fact that oral health really starts as a child, or even maybe you had mentioned to me.
No, you did. You said the embryo.
The embryo, the pre. It goes that far back.
That's right.
Or back that far. I mean.
That's right. Yes, we want to. It's important that we establish those patterns early, right? And most oral diseases are preventable.
And we don't do enough about that.
Well, and it seems pretty basic, but it seems to be really difficult. Diet and dirt. What we put into our mouth. Refined carbohydrates, refined sugar, sugary drinks. And I think it's even more difficult today because when you go into any of the stores practically, all of at the checkouts, there's refined sugars, refined carbohydrates, particularly at the eye level for children. So that's one thing, what we put into our mouth, and of course important to avoid alcohol and tobacco products as well. And also the dirt part, the dirt being, the debris that's in the mouth, which can be the biofilm or the food that's left in the mouth. And so that needs to be cleaned away at whatever age we are. And it's not easy to keep our mouth clean. And it gets more difficult as we get older.
One of the things I think, let's just talk briefly about children, because we have grandparents, for example, that are watching our program today. And I'm sure that they would be interested, that they want good oral health for their grandchildren. So what should you be doing with children?
Well, again, be careful about the snacks. That's really crucial. Try and stay away from the sugars, and preferably water for hydration rather than kind of sugary drinks. Make sure that the mouth is cleaned, and at least twice a day. I say we do it in the morning for the rest of the world. Right. And we walk out to the rest of the world, and at night before we go to sleep. That's for our own personal well-being. And with children, you may have to, there's a lot of similarities between toddlers, children, and the frail elders that are dependent. So you may have, you get in there and help and make sure, because it's the tissue. It's really important if we can clean that area around the tissue and keep that free.
So this goes beyond just brushing your teeth.
Oh, way beyond that. And that's really, I wish we could get away from that word brushing, because when you think of brushing, you think of brushing your hair, and cleaning our mouth is way more complicated than running a toothbrush by our teeth. And if you look at some of the ads that are presented now, the toothbrush is just, it's nowhere near where the biofilm is. I think I mentioned that the bacteria just wave because the toothbrush has just gone right straight by them. But it's important, and it's a really difficult area to clean, that tooth-gum interface, because you've got very, very sensitive tissue, one of the most sensitive tissues in the body, right next to the tooth, which is one of the, it's the hardest. And so you have to be careful that you don't scrub too hard.
No, and when we're talking about biofilm, is it you said?
Yeah.
What does that actually mean?
Well, when you think of biofilm in your pipes, when you think of that.
All right.
Okay, so you've got an accumulation of bacteria, and it's very, it adheres in such a way that using a brush doesn't actually effectively remove it from your gum tissue. So if you could think, if we could change our thought process to thinking of using the side of the brush like a soft cloth.
Right.
And so I think of it when I talk about, you know, when you're cleaning your kitchen counter, like you'd never think of cleaning that with a brush.
No.
You're going to take a cloth.
Correct.
And you're going to wipe it off. And that's what we should think about when we're cleaning around our gums.
So we need to do this twice a day. That would be the minimum, I would think.
That would be the minimum.
That would be the minimum.
And just because there's other things that need to be cleaned when we talk about the. Oh, you go ahead and then I'll fill in.
No, I was just thinking about the fact that as an older adult, you might not have the ability,
Exactly.
I guess. Would that make some sense to be able to do that?
Oh yeah, no, that and I want to go in a little more details after about frailties, but supposing, so you know, we don't always have the same amount of flexibility,
dexterity, and everything. Yeah.
Well, and working with in situations like that, modifying the handle on the brush. Or it might not just be the brush, because there's a lot of other things. There's embrasure cleaners, and really to clean the whole mouth, you need to clean the biting surface and the inside and the outside and in-betweens and the contact. It's not a simple job.
And I would say, this is my opinion at this point in time, is that people watching today aren't even thinking about all of this.
I know. That's why
they're
we're here.
thinking about brushing my teeth twice a day, and I got to make sure about that, but they don't think about their mouth being clean. There's a difference here.
Right. Huge difference.
Yeah. And so we have to really educate people on that, because it's so very important. We're not going to have time right now in this segment, Lynda, but it's important to identify the fact that if you don't have good oral health, there's a whole bunch of other things that can happen.
Well, particularly, and that's why I like to focus on the gums, on the tissue, because if the gums are bleeding, they're wounded. And we talk about chronic inflammation, and that's when the tissue is inflamed, and that can affect all parts of the body. And
so let's get into that in our next segment, because I think that's really, really important. So keeping good oral health is so very important, because, as I say, it can broaden itself to have other impacts health-wise on you. So Lynda McKeown, my guest, and we're going to be talking about oral health, and stay tuned when we come back. And we're looking forward to more information about how important this is for you and your general health. And stay tuned. Thanks. Well, welcome back to Age Friendly. Our guest today is Lynda McKeown, who is a registered dental hygienist here in the community of Thunder Bay, and we're talking about oral health and how important that is. And Lynda, we talked about what it means and all the rest of it in our last segment, but talking about the fact that if you don't have good oral health, it impacts other components or other parts of your body.
Yes.
Don't think about that. Most people, I don't think, do.
No, I don't think we do, even though we're going on about the systemic relationship, and that systemic relationship has been recognized for thousands of years, right? It's just we've lost it somewhere along the line.
Right.
But that, particularly the tissue issue, that chronic inflammation can impact so many areas. And we do know the interconnectedness of with regards to diabetes and the relationship or interrelationship with cardiac issues and so many diseases. If we think more, in my opinion, about the tissue and that, I think we're better able to understand when we think of the tissue as I mentioned about the mucosa. You know, here we've got the oral mucosa, start of the digestive process, all the way down to the entry point. It makes it, I think it makes a little more sense when we talk about that.
But to think that if you don't have good oral health, that can impact your heart, it can impact your, diabetes and a variety of other things. And I was just thinking about, you can have stroke, you can have lung disease, because some of the information.
That's a huge one with regards to the respiratory illnesses.
Right.
During COVID, dental hygiene was shut out of long-term care.
Oh.
And what a terrible time to be, exactly, because we're not considered to be essential healthcare providers in long-term care. But that's one time people really, really needed a clean mouth.
Yes.
So that would prevent that debris from aspiration pneumonia occurring.
And as I say, I'm repeating myself again, is here that how important it is to recognize that oral diseases that you could have are preventable as well. So that's, how do we do that? How do we make sure that it's preventable?
Well, it seems pretty simple, actually. I mean, what we put into our mouth and how we keep it clean. It's simple, but behaviors are established, and they're difficult to change behaviors, right? And just going back to the point about the interrelationship, and sometimes the things about the language, if somebody's hand or skin was bleeding to some extent, I mean, they'd really think about it, but and call it, in nursing terms, as wounds.
Right,
When the gums are bleeding, there doesn't seem to be that same perception about it.
That there's something wrong,
It's actually a wound. It's an oral wound, and if we can start to think in those terms, I think maybe it's more helpful in recognizing the potential diseases and recognizing, maybe feeling around and if...
Right. When you're in long-term care, is that something that you should have an automatic checkup on all the time? Never mind the fact that even if you're in your own home, you should be checking this all the time.
You mean a person?
An individual.
Well, in long-term care, I mean, people are in long-term care because they can't look after themselves anymore.
Right.
So that's kind of leads me to the topic of frailties, and in people in long-term care, according to the regulations, they're supposed to get their mouth cleaned twice a day, and if they can't do it themselves, they're supposed to do it for them. In all fairness, the people assigned the task, don't have that training and expertise that the dental hygienists have in maintaining a healthy mouth. And I want to talk about frailties a little bit because it works both ways. As we age, there's a change in our cells and our tissues and our organs. I mean, I can look at my skin and my fingers and my nails, and I see the changes, and it's, it's quite obvious that the aging process is going on, and that happens in our mouth. And so very often we have more exposed roots of the teeth, and there's tissue changes as well. There's very bad news in that very often the teeth die because the secondary dentin occludes the pulp, which I mentioned is the nerve and blood supply, and that's the living supply of the tooth. So when that's occluded, the tooth dies.
Could break off.
Exactly.
Okay.
Yeah. No,
well, that's not good.
No, that's not good. It's bad news. But the good news is, because it's dead, it usually doesn't cause any pain. It can be asymptomatic. So in fact, you can probably live with that to end of life in that way. So the frailties in the mouth. But on the other hand, talking about the frailties in the frailties of the body impact how we care the oral health of ourselves,
Right.
our oral self-care. Because, as you mentioned, with regards to, say, arthritis and lesser abilities to be able to manipulate these things, or with people with have dementias and physical abilities of not being able to manage your dental hygiene
Right.
tools or your oral health tools. And you need help at that point.
So if you're arthritic, for example, I pick up on your comment about that, and you can't manage, to clean your mouth, et cetera, is there something that we can get to be able to help us do that?
Yes, us, the dental hygienists.
How important that is, yes, of course.
Call us, we'll come and help you.
But is there some equipment that you can use and have adapted for you?
Some of the power brushes have a larger handle on them, and they'll do the little jiggle for you. And we can modify, as I mentioned, there's a number of tools that we need to really keep our mouth thoroughly clean, and those can be modified so that they can be managed.
Is it one of those things that, how do you make a decision on how you're going to do some of this work with your mouth? Because you've now decided it's important. What is it that you would recommend a senior do right away if they're thinking about they better improve their oral health?
Well, probably the best thing is to, depending upon where they're starting. I mean, many seniors have had regular care if they've been in a situation economically, et cetera, that they've been able to do that. So many seniors have had extensive, actually, extensive restorations and perhaps, removable prosthetics and implants and very complicated. So those folks have been monitored along the line. So one would hope that the professional that is taking care of them will be monitoring them as well to see if there's any changes that they need to make modifications in their treatment plan. If it's a senior that hasn't had care over the years, I mean, there are some government programs that they can apply for, and there are independent dental hygienists that will come to their home and meet them where they are.
I think
does that answer your question?
Yes, I think it does. And I think the important thing is that people take note of this, and it's something that is ongoing, and it's something you do for the rest of your life. It's not just, well, today or this week, I'm going to look after my oral health. It's an ongoing.
Well, that's right. But like other things, Rebecca, it's modified. Yeah. Right? Just as you might have to, you person, not you, but a person becomes a little less stable and they have to use a walker. To get around a little bit. That might mean because as I mentioned with the tools and whatnot, sometimes people, even though they can manage it and they know how to do it, they don't have any strength anymore. No. And so that's when, you call in the dental hygienist to come and help.
And I think with our next segment, we're going to talk, Lynda, about the fact of what kind of services are there available here in Thunder Bay, and how can we assist our older population. So stay tuned for Oral Health. Lynda McKeown, my guest. Well, here we're talking about oral health and how important it is for you in the fact of it's important in regards to your overall health. Lynda McKeown, my guest. And Lynda, one of the things that we've talked about is, this is an ongoing situation to look after your oral health. It's not something you do for a week or whatever. We mentioned that. But what kind of palliative care do we need to have at this point?
Well, we need to do modifications, just as we do with the physical activities and physical abilities. There's modifications that we make, and we've just recently, actually, it's in the textbook now, palliative dental hygiene oral care. Now, when we think about palliative care in medical terms, we think of palliative care usually about 2 years to end of life. Palliative dental hygiene care begins when a person cannot manage their own oral care by themselves. And so the palliative dental hygiene care can go on for a decade. So we'll come in and the dental hygienist can come in and fill those gaps of actually doing the more thorough. It's a soft debridement. It's not we're not talking about the scalers, but using the oral physiotherapy tools to remove the debris and biofilm and keep the tissue healthy.
So do I just, if I wanted to have some extra assistance and care, I call a hygienist and that they would come and assist me? I know I have a friend who I'm a POA for in a long-term care, and I hire a hygienist to come in every 3 months to check her. So is this something that you would recommend?
Oh, absolutely, yes.
Yeah.
Yes, if it comes to a point where a person can't get out to a clinic of some sort for dental hygiene care, there are independent dental hygienists that will come in, and there's also a dental hygienist with a van that will go to your home.
Right.
So we can meet you, we can work where you live, you know. Some people, I do palliative dental hygiene, oral care. Many folks I see them every week, and do that debridement and keep them healthy. And in saying that, when it reaches a point when, you know, the teeth may break, and I mean the goal is to keep everything maintained to end of life, and we're unique, right, as individuals, so we age and our frailties are different, so some of us may reach end of life with all of that reconstructed work that we had done, and others, they may break off, but we can maintain that and help folks maintain a functional, healthy mouth to end of life.
Right, and that's what you really want.
That's my goal. Yes, is that oral health is maintained to end of life.
Yes. And well, as I say, to me, it can impact on so many other things, so you want to make sure that that is in place. Now, there's a program at the college about preventative oral health services. What's that about?
Well, there's it's oral health program at Confederation College. Yes, there's a dental hygiene program, dental assisting and dental hygiene program at Confederation College, and the dental hygiene students are in the clinic, and the public is welcome to make an appointment, come in. Have to be prepared to spend some time in the chair. It's a learning experience, so this is a benefit for the students, of course, but it's also a benefit for the public because the cost is very reasonable, and you have full examination. And learn those techniques about how to keep your mouth clean, and you know, some behavioral changes with regards to what you might be putting in your mouth. Yeah.
Right. Would that be something you just call the college and they would give you the information and
That's
details
right, yes.
and how to get involved?
There's a clinic, a reception clinic. Yes, it's attached to the...
And this is a good thing, that we can do this at our own college here in Thunder Bay.
It's been here since '76, but people seem to be just
finding it out. Well, then they need to be contacting the college, and it's a good thing. Now, there's programs that are established by the government that help for oral care, for oral health care as well.
That's right. There's the Ontario Seniors Dental Care Plan, and that's offered through the Thunder Bay Health Unit. And then the recently introduced one is the Canadian Dental Care Plan.
So there is some assistance here for people if they need to be really seriously looking at.
Yes.
Yeah, and not everything is going to cost you a lot of money. I think, isn't the health unit, I don't want to put you on the spot, but the health unit is reasonable also for pricing.
Yes, yes.
So it's...
And the introduction of the Canada Dental Care Plan is a welcome introduction, but there's some major limitations with regards to that. It's some little bumps to be ironed out.
Well, I think that it's like government programs. It takes a little while before it. But I have my little card now for that. I signed up, and now I have to get the dentist to. But that's the next step in all of this. But at least it's in place. Yeah. So that's a good thing. The government recognizes that good oral health. Was something that will be beneficial for indivials
But I do want to strongly make the point that fixing teeth is not going to fix the problem of oral diseases. Yeah, no. I think we both agree on that. Yeah.
And it's important for people to recognize the fact that oral health is more than, you're right, about teeth, but it's also the fact that it has such an impact on your health overall.
Absolutely. Yeah. And it's a mirror. You know, you can look in your mouth. You can't look at your kidneys.
No, that's right.
Yeah.
Maybe that's a good way of putting it. You can think about your teeth and your mouth
your gums.
as an organ, so to speak, in your like as your part of your body. I like that.
Yeah,
that's a good way of doing it.
You can look at those tissues. You can't look at your lung tissue or your kidney tissue.
That's not a bad thing at all, Lynda. To be quite honest with you, I think that's a good comparator, so that you can actually make some change in what you're doing with that. Yeah. Lynda, thank you. This is good. This is good information, identifying the fact that we really need to be looking at oral health, and I don't know that we do that as well as we could or should do. So the information that you provided is really been very valuable today.
Well, thank you, Rebecca, for the opportunity of promoting the oral health.
It's good. Let's see that we have more people that'll be looking at their oral health. Now we're going to switch our program over to Lynda DePiro for our last segments of our program today to talk about the 1-minute exercise and for you to get involved and be part of making sure that you're a healthy person. Lynda, again, thank you very much for today.
Thank you.
Hi, I'm Lynda DePiro, and today our exercise involves movement in a frontal plane. So that is movement side to side. I'm just going to start with lower body side to side. These are just very lightweight little balls, just something to hold on to as I move my arms in a lateral line as well, right? Frontal plane. From here, we can change the arms, pulling it back. I'm just going briefly through this, but when you do this, please add a few more repetitions. Standing wide, reaching the arms, here's the windmill, upper body. Add your little side bending knees. All right, now watch this. Going over to my right, left arm up, but switch. And then we have a different feeling here with side flexion as we go side to side. It's kind of a nice little feeling. This one I'm just going to do on the one side. I'm going to reach down. It's a progression and up. I'm going to reach down, bringing it in. Reaching down, bringing it in, adding a lift. Taking it down and reaching and lifting the leg. And then you want to try to get it so it all flows together in a fluid movement. Okay, then let's add 2 steps to the right. So we're gonna go 2 steps and 2 steps. Circling the arms, all right? Adding a lean. As you can see, I'm still working laterally in that frontal plane, adding a little lift, and 2 more. Okay. Oh, let's do 2 more. I like this one. All right, so keep moving in all planes of motion, adding the rotation and the sagittal, and motion is lotion. See you next time.